Hello viewers, today's topic is rabies. Rabies is also known as hydrophobia. Introduction. Rabies, also known as hydrophobia, is an acute, highly fatal viral disease of the central nervous system. Rabies words come from Latin words ravas meaning psychosis or an act of fighting. It is primarily a zoonotic disease of warm-blooded animals, dog, cat, jackals, wolves, and bat. It is the only communicable disease of man that is always fatal. History. One of the oldest diseases of the human civilization, it is about 2300 years old. Global scenario of rabies. Rabies occurs in more than 150 countries and territories, all continents except in Antarctica. Globally, every year 60,000 human deaths occur due to rabies. 40% of people who are bitten by suspect rabies animals are children under 15 years of age. More than 95% of human deaths occur in Asia and Africa. Every year, more than 15 million people worldwide receive a post-exposure preventive regimen which is estimated to prevent 327,000 rabies deaths annually. Site of bite. We can see a pie chart showing different site of bite. Epidemiological determinants. Agent of rabies. Rabies virus belong to the genus Lyssavirus of the RNA Rhabdoviridae family. Currently, this genus comprises 7 genotypes, type 1 of which represents the classic rabies virus. Host. Warm-blooded animals, human, dog, cat, jackals and wolves. Although all age groups are susceptible, rabies is most common in children aged below 15 years. Source of infection. The source of infection to human is the saliva of rabies animal. Mode of transmission. Animal bite, licks, aerosols, person to person, rare but possible, eye and other organ transplantation. Reservoir of disease. Animal transmitted the disease. Incubation period. Commonly 2 weeks to 6 months, average 3 months, depends on the site of bite, severity of bite, number of wounds, amount of virus injected. According to site of bite, incubation period may shorten at the head and face about 1 month. No tests are currently available to diagnose rabies infection in humans before the onset of clinical disease. Pathogenesis. Inoculated virus is transported to the central nervous system via the peripheral nerves. On arrival in the brain, it replicates and disseminated rapidly again via the nervous system to many different tissues, including the salivary glands. We can see a figure showing the entry of virus to its replication. I have arranged it sequentially from 1 to number 6. In 1, virus enter via animal bites. 2, virus replicate in muscles at site of bite. 3, Virus infects nerve in peripheral nervous system, moves by retrograde transport. Number 4. Virus replicate in dorsal root ganglion and travels up spinal cord to brain. And number 5. Brain infected. Number 6. Virus travels from brain via nerves to other tissues such as eyes, kidneys, salivary glands. Clinical picture. Initial symptoms are fever and often pain or pricking or burning sensation at the one side. Treatment. There is no specific treatment for rabies, but we can treat the symptoms of rabies, and the ultimate prognosis of rabies is death. Prevention of human rabies. Pre-exposure prophylaxis. Pre-exposure vaccination is recommended for anyone at increased risk of exposure to rabies virus. This recommendation includes laboratory staff, animal handlers, wildlife officer. Recommended post-exposure prophylaxis for rabies infection. We can see two column. In first column, category of exposure to suspect rabies animal. In second column, we can see post-exposure measure. In case of touching or feeding animals licks on intact skin, there is no necessary of post-exposure measure. Or in case of in category 2, there is a minor scratch without bleeding. In that case, post-exposure measure is immediate vaccination and local treatment of the wound. In category 3, there is single or multiple transdermal bites or scratch, licks on broken skin, contamination of mucosa member with saliva from licks, exposure to bats. In that case, post-exposure measure is immediate vaccination and administration of rabies immunoglobulin, local treatment of the wound. Prevention. Eliminating rabies in dogs, vaccination of animal, mostly dogs, preventive immunization in people. Pre-exposure immunization in people is recommended for travelers to high-risk areas in rabies-affected countries and for people in certain high-risk occupation. Thank you. Please subscribe my channel.